Hi, this is Dr. Lewis Cady coming at you from Cady Wellness Institute. There are several things on my mind this morning because of what I've been reading about in the popular press and also the scientific literature. Most people these days, unless they've been living under a rock, know about the GLP-1 agonist. You might not know them by the category, but Mounjaro, Saxenda, Ozempic, etc. The weight loss shots. And there are clinics that are now doing these with compounded formulations, and they're really not thinking about what they're doing. So let's back up and take a look at it. There are reasons for the GLP-1 agonist, and there are also reasons not to use the GLP-1 agonist. The reason for the GLP-1 agonist is diabetes, metabolic syndrome, and people that just cannot lose weight because their drive to eat overcomes their ability to control it, and frequently through no fault of their own. It's not a moral failing, it's not a character flaw, it's just biology in some people. So those folks will benefit from the GLP-1 agonist. Now, most of us other normal types that are just carrying a few to maybe many more pounds than we need would like to lose it. And so they follow the siren song of the weight loss shots. The problem with these is that once you start on them, it's almost like you're addicted to them. You can't go off, or the appetite suppressing effect goes away. You have lost both muscle and fat during this time. And so when you refeed, even if you're eating rabbit food and lettuce all the time, you'll gain weight, and you'll gain it with interest. You'll have more weight coming back than you started with. So those are a couple of problems. And then in the medical literature now, we're seeing things about the GLP-1 agonist, which on the one hand can help with mood and depression symptoms, but on the other hand can kill your motivation, kill your sex drive, and turn you kind of into a numbed out zombie. In fact, there was one TikToker that I saw that talked about how Ozempic had messed up her sex life. So the responsible way to use these medications is conservatively and precisely, and not to overdo it. And also to monitor the patient's mental health and status as the patient is on these agents. And that's the responsible way we're going to do it at CWI. We have a GLP-1 program coming out soon, and I've got all kinds of new energy toys for the use of my patients in my practice to beat the muscle wasting of the GLP-1 shots. That's it for now. Thanks for watching.